begin with anything else, I'd like to acknowledge that the traditional owners of the lands we're sitting on as we meet by video today. I'm on Kaurna land in the Adelaide region, as would many of you be. I'd also like to pay respects to the elders past, present and emerging, and acknowledge the thousands of generations long culture of the traditional owners, which is still living and as important today as it ever was. So welcome to the panelists. Thank you for joining us and giving up your time for the discussion today. And welcome to all those who've registered to listen and consider and ask questions. The group that's organised this webinar is the Child Protection Practice Group of the South Australian branch of the Australian Association of Social Workers. Our group's objective is to contribute to improving the protection of children in our community and the effectiveness of the many aspects of the system which attempts to protect children who are harmed or at strong risk. Given that we are social workers, we have focused some of our efforts on thinking about what parts social workers can play in improving interventions in children's lives. So the topic for today is best practice social work responses to child abuse and neglect, improving protective outcomes for children and families. We understand that many of those who work in the child protection related agencies are not qualified as social workers. However, from our perspective, the knowledge, values and skills of social work are really those held as the general standard for the roles of anyone working in case management, assessment, protective intervention and family support. Therefore, we suggest that our discussion of social work today will be relevant to most of these workers' roles. I would like to ask Dr. Fiona Buchanan to speak first. Fiona is a senior lecturer, Justice and Society at the University of South Australia. Fiona oversees the section of the social work course that focuses on child development and child protection.
And first thing I think is child-centred, the real ability to focus in on the child, to be there for the child and to communicate with the child in an age-appropriate fashion. Relational, I happen to think that you can't actually really be a social worker on the ground without being relational, without having an ability to build relationships with people of all ages, including children. And the other one I think is non-judgmental. So being able to apply theory to practice, but leaving judgment out of it. Assessment's one thing, judgment's something different. For the next question, I'm rattling through these because I know I've only got 10 minutes. What do you think are the 4 most important qualities of a social worker for child protection? First 2 go together, humble and inquisitive. And they go together because if you're humble, you'll ask questions. You don't see yourself as knowing all the answers. Knowledgeable, but also prepared for lifelong learning. So you may be knowledgeable, but you know that there's always going to be new things to learn, new things to move on to. You haven't actually got all the knowledge that you'll ever have. And the third one was emotional. Well, yeah. 4th one really, because humble and inquisitive went together. Emotional intelligence I think is really important. So that's the capacity to be aware of and to express and handle your own emotions while at the same time handling client and professional relationships thoughtfully and with empathy. Next question was, how can graduates be best prepared for social work that is protective towards children? Huge question. I think first of all, and I bang on about this quite a lot to social work students, to understand that whatever works social workers undertake, they need to pay attention to the needs of children, whether as clients' children, young carers, grandchildren. So whether you're working in a child-centred service or not, you need to be aware of children and able to engage with them and intervene on their behalf if you need to. And that's not just about reporting. That's also about maybe interpreting what they need if their needs aren't being met within the family, within the care home, wherever you come across children. And to have an understanding and knowledge of the effects of inequality, of poverty, of violence and coercive control, and the effects that these have on children. So have a real deep understanding of these and know about the effects of these on children and on families. Next one, how are we doing for time? Okay. What are your 3 highest priorities for change to achieve best practice at systems level and through individual practitioner? First of all, back to the start, really, the voice of the child needs to be heard and accurately represented. And these things again go together. And there needs to be an understanding that social work practice is not linear. There's no formula that you can apply. And that's, if you like, back to applying knowledge and emotional intelligence. So a wide-ranging knowledge, but also that emotional intelligence, both come in there. And the last question is, what's your top priority for preventing child abuse and neglect in South Australia? Every social worker should be able to engage with children and build a relationship with them. And this might be through play, it might be through drawing, it might be through going to the park with the child. But know that age-appropriate engagement can involve a whole lot of ways of being with children. And the purpose is so that they know that they matter. Every child knows that they matter and are supported.
So I'm going to move on to Kerry. Beck.
You'll find, have banged on quite repetitively about some major themes in this through these questions. So I'll probably go into a fair bit of detail here on the first slide and then might skip through some of them as they repeat.
May
Sorry?
I interrupt? Because I didn't really introduce you properly, did I, Kerry?
Oh, no, I didn't introduce myself either.
No, sorry, I beg your pardon. Director of the Safer Family Services, Community Family Services Division in the Department of Human Services. So a big area to cover, Kerry, and if you wish to enlarge on what that involves, please go ahead. Okay, great.
So moving on to the questions. As I said, there's probably 3 really strong themes that will go through my presentation. You'll probably hear a bit of repetition there, but the first one there around key characteristics does start at the same place that Fiona did, and that is about the child in focus, no matter the system or the service context. I think this is really critical for us to understand that where there are vulnerable adults, there will always be vulnerable children, and we need to see them, and we need to hear them, and we need to incorporate them into all of our service delivery. One of the things that really brought this to the fore for me was back in 2010, I was working in homelessness, and it came to my attention that we had about 23,000 people go through the homelessness system in South Australia in a year. And with those 23,000 adults, there were 12,500 accompanying children, none of whom got a service delivery response in their own right. So I think it's really critical that we understand as social workers that no matter where we are and who we're working with, there will likely be children who are vulnerable and dependent on the adults we're working with, and we really need to see them. So that's number 1 for me. Number 2, I'll also bang on a lot about in this presentation, that's cultural humility and understanding. Aboriginal families are the primary client of our child protection system. Over 70% of all Aboriginal children end up with a child protection notification made about them. And I guess first and foremost, I think it's our responsibility as social workers to interrogate why that happens. and ask ourselves, about the racist assumptions that are made about Aboriginal families, the assumptions about parenting, and the imposing of Western cultural ideas on the parenting practices of Aboriginal families. And we really need to look at that and understand that from the perspective of Aboriginal families. I once heard Kathy Taylor from Child Protection say that if you were going to rub out and start again with the child protection system, you would design it specifically for Aboriginal families. So I think that it's absolutely critical that we change the way we approach that. And we also have to interrogate ourselves and our own power and assumptions and stop looking to Aboriginal people to make sense of things for us. We have to stop othering people and look to whiteness and our own cultural impact. Number 3, curiosity and commitment to evidence-informed approaches. As Fiona said as well, we have to approach our work curiously. We can't assume that we know things about other people and families and children. We have to be curious and we have to find things out. And in that process, we need to listen deeply, be interested, and also look at evidence to guide us. We can't assume that what we already know is all there is to know. The ability to sit in your own discomfort comes next, and these next couple are inextricably linked. We really need to be able to be prepared to address our own biases and sit in the discomfort that we feel when we're helping families to address the issues that are going on in their lives, and not to look to others to make it comfortable for us. It's our role to make it comfortable for them. I think this is really important, and it's also really, really difficult to do. If it makes us comfortable, then I think that's okay. Uncomfortable, I think it's okay. You're probably doing your job properly. And we just need to sit with that. We had a really great example of the next one around preparedness and skill to have difficult conversations with people when we were working with our lived experience group, who are helping us inform the reform that we're developing. And we were speaking with this young woman, and she said that she had been working with a social worker for over 12 months. From a relational social work perspective, they had a great relationship. She thought everything was going really well. But at no point did that social worker actually find it within themselves to say to her, if you don't give up drugs, welfare will take your children. And so 12 months later, she thought everything was going fine. The relationship was great. She was still using drugs. Welfare came in and took her children anyway. So the ability to actually address the issues that are in the lives of people to help them make change is really critical, and we have to be able to do that regardless of whether it makes us feel uncomfortable or not. Number 6, we talk in child protection and the area of family work a lot about holding risk in agencies or with practitioners. And I guess one of my takeaways for people from today is to ask yourself what that actually means. What are we worried about? Is it organisational risk, political risk, personal risk, professional risk, or is it actual risk of harm to a child? I think we really, again, have to interrogate that in ourselves. And once we've worked that out, we need to work out, what am I prepared to sit with in order to keep a child safe? What level of risk and discomfort for myself am I prepared to sit with as a social worker to keep a child safe? And do my organisation and my colleagues support that? The last one is around self-care. This is really hard work. We need to look after ourselves so that we can make it about the children living with the experiences rather than make it about ourselves. It can be a brutal system. It's built on the relentless nature of the work and what we have to engage with. And over and above everything, we have to maintain our compassion and our kindness to ourselves in the face of the trauma that we witness. So I really encourage people to understand their own selves and how they care for themselves over, working in this space for a long time. So what do I think the 4 most important qualities are? Compassion, kindness, curiosity, and child focus. That's probably 4 in 1, I realise, but I thought I'd just group them together a bit. Cultural humility and understanding, as I talked about. Trauma-informed, responsive or specialist practice is really important, and I would encourage anyone to do some additional study or look more closely at those areas of how we work, particularly, again, around working with Aboriginal families. We know that Aboriginal Australians experience intergenerational trauma of colonisation, dispossession, genocide, stolen generations. And they were all policies that were enacted by our profession in history. So it's actually really important that we, going in now as social workers, we understand what that trauma means for families and how we work with it differently now. And also the effects on the brain of early childhood trauma. And that trauma lives on in the body, and our systems re-traumatise people. Lastly, there a preparedness to really interrogate our own practice and keep up with the emerging understandings in data. Again, I think that if we get lost in it being about us rather than about the people we're working with, we can get lost in practice wisdom being everything. And I'm a strong believer that practice wisdom is extremely important, but it needs to be balanced out with data and evidence. We need to make sure that what we're doing is evidence-based. We can't get caught in a system where fear drives an unhealthy focus on our own internal practices rather than what's actually happening around us.
Now, our next speaker is going to be Colin Sparrow. Colin is a supervisor of an assessment, support and protective intervention team in the Department for Child Protection. And you may want to say a little more about that, Colin, but over to you.
Hi everybody, I'm Colin. As I said, I'm a social worker in the Department of Child Protection and currently supervising a team in the South doing assessment and support. So our team fundamentally deals with the initial child protection investigations and engagement with families. I think high-level relational skills that actually support engagement with families. And specifically, I think it's really important, and I'm actually doing some work around it, some reading around this at the moment, that actually is able to provide emotional support. You know, clients tell us all the time that the provision of a service is insufficient. They actually need emotional support. And we actually need to learn how to develop trust as a precursor skill, and that's really difficult sometimes in our business. I think you actually need to believe in family-led, strengths-based and safety organised practices, which is a bit of a kind of mouthful. And that has to be you actually have to believe it. We often talk about it and people get trained in it and people go off and do it, but I actually think you have to believe in it if we're thinking about the qualities of skills. And again, I want to echo, and I'm really annoyed that Kerry stole this because I was wanted to be the first one to say it. But I'm going to paraphrase again Paul Nixon, who definitely talked about that, you know, that we need to adopt practices that are accessible for our Aboriginal and Torres Strait Islander clients, and we need to make them the way that we do our business more generally. And as Paul said, if you get it right for your Indigenous population, wherever you are in the world, then actually everybody kind of likes that. So I think that's a starting place. I think critical thinking and the ability, and I stole this from Einstein actually, but I think you actually need to be able to write about really complex things simply. And that's a really important skill that often is one of the ones that graduates find really difficult because they spend all the last year learning how to write about simple things really complex to impress their tutors. And then actually what we need to be able to do is write about really complex things to make them accessible to families and to people who are not necessarily experts in the areas that we are experts in, and the disadvantages that our clients experience and that are actually not that easy and not amenable to child protection responses, because what we're actually doing is we're actually individualizing problems that are actually systemic and broader. So we make individuals responsible for the fact that they're poor, black, uneducated and living in the wrong part of town. And those become issues that the state chooses to respond to. And that's a real conundrum if you're in the state system, in my view.
Now, we had a request for a little bit of a change around with order. So I'm wondering, Rebecca, are you okay to go next?
Yes, I can go next.
Okay. Rebecca is the clinical coordinator of the guardianship services with CAMS, Child Adolescent Mental Health Services. So you might like to describe a little bit more of your context if you wish, and over to you. Thank you.
So I chose to kind of highlight 3 characteristics of best practice. And for me, I've probably thought about these mostly in the context of mental health and providing therapy for children. So they are child-focused approach, trauma-informed practice, and also partnership and collaborative practice. So as others have already highlighted, when we're talking about a child-focused or a child-centred approach in child protection, for me, I'm really talking about all elements of our work. We keep the child at the centre. So it includes thinking about the child's experience, their journey, their development, and also their trajectory. You know, how we engage families, make case decisions, engage with stakeholders, all need to keep the child in mind at the centre of those conversations and our thinking. I think it's really easy in this hard area of work to get caught up in the chaos or the tensions and the struggles. So I think we need to be really intentional and purposeful that we keep the child in mind at all points. I also think it's really, really essential to have skills in reflective practice and supervision. And for me, we need to prioritise and value this. You know, whatever the area of work you're in, whether you're, you know, kind of a therapist or, you know, it doesn't really matter the work. I think that you need to be doing reflective practice and good supervision. For me, that's a part of self-care, but it's also a part of just good quality social work delivery. Leading into, I guess, how graduates can be best prepared for social work that can be protective towards children. Again, I've thought about it in the context of mental health, and I've put it under 4 different kind of banners. I think, you know, in this space, we need to understand the child. We need to understand developmental theories, trauma knowledge and trauma lenses. We also need to understand attachment. We need to understand the system in which we're working and in which these children and families are living and having experiences in. So, you know, we need to have that systemic and that contextual knowledge to inform our practice. And finally, but perhaps even the most important, is valuing yourself and really prioritising self-care and all that that encompasses for you. You know, if we can't take good care of ourselves, we actually can't be the best social worker we can be to do the job that we are passionate about. So we absolutely need to be embedding that as part of our practice and finding good balance.
To Shirley Young. Shirley is now working as a consultant in Two Worlds Consulting. She's had long experience across government agencies and in her roles as consultant. But yes, I'll let Shirley tell you a bit more about that as I hand over to you. Thank you, Shirley.
Hello, everybody. Thanks, Mary, for the introduction. So I'm Shirley Young. I'm a Nukunu woman. I'm a social worker and I'm the director of Two Worlds Consultancy. And I just want to thank you for inviting me to come and speak today. I decided that when I was looking at these questions, I wanted to actually respond as you know, as an Aboriginal woman and how our Aboriginal families might want to see these questions answered. I also just want to acknowledge that I'm sitting on the traditional lands of the Kaurna people, and I want to acknowledge other Aboriginal people that might be viewing from other Aboriginal lands, and also to acknowledge my brothers and sisters who might be Aboriginal social workers out there. And I just want to honour you for the work that you do in this very difficult field where unfortunately Aboriginal people are completely overrepresented. Characteristics of best practice. So from my standpoint, I think that it's really important for workers to be able to acknowledge history, and even though historical events have occurred and, you know, they haven't necessarily been there, that we still see, you know, the effects of what's actually happened from that. And so for me, it's really important for social workers to be able to acknowledge that, that, you know, there has been this history that organisations and that, you know, have impacted on Aboriginal people. So just being able to acknowledge that there is a history, to me, is really important in a characteristic for workers. Another thing that's really important in terms of characteristic for best practice is also actually recognising, you know, there's a need for cultural responsiveness, and that that people need to have an ongoing commitment to learn and to deliver services in ways that are appropriate. And that's really important, that we see non-Aboriginal staff working with our families that have an ongoing commitment to actually do those sorts of things. You know, another thing for me around best practice would be around understanding that for Aboriginal people there's such great diversity, and that there isn't not one way of knowing, that we have very different belief systems, but you know, and I think it's really important to be willing to actually know that we don't know everything, and that we sometimes need to ask questions and consult with others. And so cultural consultation and working with other Aboriginal staff and the principal Aboriginal consultants, I think is actually really important, because they bring a very valued opinion about how they see what is happening and the things that could be working differently for Aboriginal families.
Yeah.
Listening. I think about creating a system where families feel safe to access services early on and in a timely manner, so that when they go for support, they actually get the support that they think that they're going to get, not you know, you're seeking assistance, we notice there's child protection issues, now we're going to, you know, deal with the child protection issues, but not necessarily provide what families are after. Obviously there is a great move towards Aboriginal-led services. I think that's really important for Aboriginal people to be providing services to Aboriginal people in ways that are appropriate. And also I think that there's got to be something where we start to look at this over-representation across all statutory services actually, and recognise actually why are Aboriginal children ending up in the system in the way they are in great numbers. And also thinking about Aboriginal assessments that are created by Aboriginal people for Aboriginal people, and seeing Aboriginal people do the work where they can in trauma-informed ways.
So is Zakia Mohammed, and Zach is currently, I think her main role is with the Australian Refugee Association, the manager of some of their programs there. But she's held many roles across government, non-government, and doing some private work. So Zakia, you may wish to tell us a bit more about what you're doing, and handing over to you.
And so paramountcy is really being of greater importance than anything else when you're looking at child protection and being child focused. And within a cultural context, it's really difficult to just look at the child as an individual, because we come from such a foundation of family. So it's really looking at the holistic family. And we've found this out more so in regards to services such as NDIS, where they focus specifically on one child and not on a whole family. So there's already systems in place that really make it difficult for CALD families to access services for one child or for a family as a whole. Just looking at it from that lens. So when we look at it in regards to what Shirley said, it's not about perfect parenting, but understand that every child has the right to be raised well and have their basic needs met in an environment where growth and development can flourish. And that growth and development for some CALD families may look very different than it does within Australia or within a Western context in regards to what is even classed as growth and development. I think the main one for my community is transparency where possible. So it's taking that time to build the relationships, getting to know individuals, getting to know families, getting to understand community, and being transparent. So it's not about, for families within the CALD context, it is really about, if a notification or something has to be made by someone who's working child protection, explaining that you're still able as a worker to journey alongside that family and to journey alongside that person. And I think that's where there's no transparency. So the fear then becomes that someone's made the notification and hasn't told me and hasn't given me the opportunity as a CALD person to explain how I live or how we live. And I think that is a really big barrier in regards to saying, yes, we're going to make a notification, but we're going to still journey alongside you. I also think being patient with yourself. So most oftentimes as social workers, as new social workers, you hit the ground running. You're in there, you do 1 week of orientation regardless, whatever the job is, and then you hit the ground running with working with clients. And I think it's really about being patient with yourself, understanding that you're still learning, understanding that complex cases are complex and families are complex. And sometimes systems are slow. And it's really having, I think it takes a lot of confidence to look outside sometimes your organization's policies and procedures, I suppose, because I think as social workers, all of us have done a bit like, maybe I can tweak that a little bit and push this boundary a little bit and meet this client's need. And that takes confidence. That takes confidence to be able to do that as well. I think create networks and build relationships. So I think for me, one of the things that has really put me in good stead is, although I've worked across lots of organizations, I know for myself, if I'm referring a client, I'm referring to a person. And if that person changes organization, I'm usually still referring to that person. They're just in a different organization, because I've made the network with a person and not so much with an organization, because I know that that person, the values, the beliefs, the understanding, all of that comes with that person.